Hello and welcome. I'm Chris Warden, the Vice President of Policy and Programs at Women Employed. And before we begin today, just a few housekeeping notes. Your video is turned off and you'll be muted for the duration of today's event. If you have questions during the presentation, please type them in the chat box. We'll do our best to address your questions and respond to your comments throughout the event. For those who are registered, you'll receive the slides and links to the reports and articles we discussed today in a follow-up email along with a recording of this webinar. Feel free to share them with your networks, but since we're recording and sending slides, we ask our guests not to use AI note takers, and we will remove AI note takers from the meeting. In order to use our time efficiently, speaker bios will be posted in the chat. And to get started, I'm pleased to introduce Women Employed's President and CEO, Cherita Ellens.
Thank you so much, Chris, and thank you to everyone attending today. A special thank you to JPMorganChase for calling out the need for this project, and not only partnering financially, but partnering with us throughout the way to ensure that the research that we produce would be effective and useful for the ecosystem. A special thank you to Molly Bautman, who was instrumental. And I think this was her vision to begin with. So thank you so much for your partnership, Molly. We have several funders and donors joining us today, and I want to thank you as well for your support, which will help drive forward the recommendations that come from this report. Thank you to our partners. There are way too many to name individually. So I just want to make sure that you know that we see you and we thank you for your partnership. This research was really important for Women Employed as we are strategically focused on strengthening career pathway systems to ensure increased economic mobility by increasing access to education and training, as we believe education and training continues to be one of the most important and effective avenues to increase mobility for women and for people of color. We've been working on healthcare career pathway programs since 2012. And in that time, we have assisted hundreds of women getting their foot in the door into entry level jobs. And most of those women have been Black and Latinx women. Unfortunately, while we are proud that, or we're, I guess, happy that we've been doing the job to get their foot in the door and to, attach women to employment, unfortunately, they're staying there. They're staying in these entry level, low paying jobs, even though most of them do have aspirations to advance in their field. And so this was the premise of this report, to understand the why behind that. And so we are looking at key career pathways to success. So we went to the source and we talked to women who have started their careers as a CNA or medical assistant and other entry level healthcare roles. And you'll hear more about our findings today. And I don't want to stand in the way to this very fruitful conversation. So at this time, I want to introduce Joanna Trotter, who is the Executive Director of Global Philanthropy with JPMorganChase and just happens to be a Women Employed Board Director. So Joanna, thank you for being here today.
Thanks, Cherita. And thank you particularly for shouting out Molly, who unfortunately no longer is with JPMorganChase, but is part of our broader family and really did lead this work. So we really appreciate her leadership. Good afternoon, everyone. I'm thrilled to be here today and to join you all for this important conversation. Again, my name is Joanna Trotter. I serve as Executive Director in Global Philanthropy here at JPMorgan, and also a very proud and dedicated Women Employed board member. As a longtime Chicago resident, I'm especially proud to be here on behalf of a company that's been investing in the city's people, businesses, and neighborhoods for more than 160 years. As one of Chicago's largest private employers, JPMorgan Chase believes that a prosperous and inclusive job market is the foundation of a strong economy. Securing a well-paying job and expanding pathways to advancement are essential for economic growth for individuals, for families, and entire communities. That's why workforce practice change in the healthcare sector is important to ensure that Chicago residents are able to not only enter healthcare careers, but as Cherita said, that they advance in them. This is why we have provided more than $10.5 million in philanthropic commitments to this work being driven by healthcare institutions and workforce organizations since 2015, really to advance career pathways in Chicago's growing healthcare sector and industry that is both a major economic driver and a source of opportunity for so many. Our approach is rooted in partnership. For example, through our support of the Chicagoland Healthcare Workforce Collaborative, we have brought together executives from leading healthcare systems to discuss their shared talent challenges and opportunities and to develop solutions that address them. And address them not just for themselves, but the entire industry. In 2018, JPMorgan Chase was a seed investor in Westside United. We're very proud of that, which is a collaborative of major healthcare systems and community-based organizations on the west side of Chicago, aimed at improving health and economic vitality in these neighborhoods. So building on these efforts, we recognize that true economic mobility comes from supporting individuals, including women, as they move into higher level positions with greater earning potential. And that's why we're so proud to support Women Employed's latest report, Navigating the Maze, Challenges in Healthcare Career Advancement. And as a company, we believe that our business is only as strong as the communities we serve. Ultimately, our goal is to help build a Chicago where everyone, regardless of where they start, has the opportunity to advance and thrive. And as such, we're grateful to be part of this conversation and to work alongside so many dedicated partners, both women employed and those on the line, who share our vision for a stronger workforce. So thank you, and I'm looking forward to today's discussion.
Thank you, Joanna, and thank you for your support and that of JPMorgan Chase. As Cherita mentioned, we approached this research because the growing focus on healthcare career pathways, which particularly for women of color, they are overrepresented in entry-level healthcare jobs. Many programs and initiatives focus on ensuring women get their foot in the door, but what happens to workers after they land that first job? Women of color in particular have a difficult time finding pathways to advance, if they're able to advance at all. And our goal was to find the keys to career pathway success. So I'd like to introduce Corinne Kodama, Women Employed's Senior Research Analyst and the lead researcher for the study.
Hi, everyone. I'm so glad to be able to share the findings from our research study with you today. Before we start, I wanted to give you a sense of what went into this project. Even though today we will be focusing primarily on the results from the interviews that we did, but there were actually a lot of moving pieces to this report that I think is important for everyone to know. So like any good research study, we started with a literature review, looking in, the scholarly literature to see what we could find out about healthcare career pathways. We also employed the Workforce and Organizational Research Center, which I'll talk about in a minute, to do a scan of the Chicago healthcare workforce. So like, what the jobs are, what the outlook is like, who works in these jobs, what the wages are. We also did our own sort of landscape scan to discover what types of upskilling programs are available for people who are already working in healthcare at an entry level and what opportunities they might have at their employers. We also had monthly meetings with healthcare workforce partners to inform the development and the interpretation of the study, which I'll talk about in the next slide. The interview study with healthcare workers, which will be the focus of today's presentation. And we also met with subject matter experts in addition to our monthly partners, which included healthcare educators, workforce development specialists, union representatives to help answer some of the questions that came up throughout the study and help inform our thinking about this project. So in terms of what we did beforehand, I wanted to thank Ellen Frank Miller and Marina Burka from the Workforce Organizational Research Center, and they did this landscape scan for us about what's going on with the workforce in healthcare in Chicago. and their full scan is in our report. What they discovered was the Chicago metro area ranked in the top 10 as having the highest employment levels for certified nursing assistants, registered nurses, medical assistants, and licensed practical nurses. However, they also found that despite Chicago hiring in the top 10, their wages didn't rank in the top 10. They also found out that registered nurses in Chicago are paid less than the national average. They did find, however, that there is a very high demand for registered nurses as well as medical assistants moving forward. In terms of the literature review that we did, we actually found very little academic research on the career paths of entry-level workers. Most of the information on workforce or career was related to higher level positions, such as doctors or dentists or nursing managers or something like that. What we did find, though, pointed to the overrepresentation of women of color, low wages, lack of career progress, and racial discrimination. So we felt like the study that we were going to do could really fill a gap given what really is missing in the academic literature. We worked with partners, as I mentioned, and I wanted to thank some of these who are here today. April Harrington from the Chicago Healthcare Workforce Collaborative, Esperanza and the Safety Net Learning Collaborative, particularly Laura McAlpine, who is retired, so she's not here now, and also Reggie Patterson, Anna Yankolev and her team from the Health and Medicine Policy Research Group. We worked with several people from Instituto, but in particular Dean Banks and Diana Alpizar, and from Westside United, Sanita Lewis and Eve Shapiro. And these partners, we met with them monthly throughout the duration of this project. They provided input on the questions, they shared insights, they reviewed drafts of report, and helped shape the recommendations. And we really couldn't have done this without them. So thank you so much for your contributions. And again, as mentioned previously, we want to thank JPMorganChase for their generous support of this project. So the key findings, overall, what we found was that healthcare education and career pathways, particularly for those who start at an entry-level position, are a very confusing maze of sort of these endless options of different training programs, different job titles, different directions you can go, different employers, that resulted in these very meandering pathways that often took women a very long time to complete. We found that workers expressed a real need for mentorship, largely because they found these pathways so confusing that could really help them navigate, their future career in a field that they wanted to work in, but was very confusing. We found, unfortunately, a fair amount of evidence of racial discrimination and equity gaps, particularly for Black women. Overall, we found a real lack of alignment between what workers, education, training providers, and employers expected and wanted and needed. There was sort of this disconnect that we'll talk a little bit more about later. And we also found that the healthcare workforce really needs salary transparency. So the findings that we have in this report, we believe are relevant to sort of everyone that's involved in the healthcare workers, from workers to employers to training providers and workforce development specialists. So now I'm going to hand it off to Efrata, who is going to talk in more detail about our findings. Oh, sorry, I need to hand it to Morgan. Sorry, who's going to talk about the participants.
Thanks. So in terms of participants, we interviewed a total of 44. All of these participants identified as women, and over half of them mentioned that they were parents. The majority of folks we interviewed were women of color, with 43% identifying as Hispanic Latina and 32% identifying as Black or African American. We had a really wide age range. Participants were between the ages of 20 and 59, with a large majority of them being between ages 20 and 39. It's important to note that over half of the participants started out in their healthcare career as either a certified nursing assistant, patient service representative, or medical assistant. The years of experience in healthcare ranged anywhere from 2 to over 31 years. And we talked with workers at a variety of institutions, including 9 different Chicago health system hospitals, 3 health system clinics, 6 federally qualified health center clinics, and a nonprofit clinic, specialty pharmacy, just to name a few. Approximately 45% were in nursing, and this includes folks who are currently enrolled in a nursing program. So despite employers and training providers indicating that there were clear career pathways, we found that workers did not have that experience. There is a lack of alignment between credentials earned, hiring criteria, wages, years of experience, and promotional opportunities, which created confusion about what is a realistic healthcare career pathway. Oftentimes, what employers say or what's in writing about who they hire and what criteria is required for jobs is not always reflected in their search and hiring practices. Women working in healthcare experience an extremely confusing system of schools, employers, and bureaucratic processes that make career pathways really murky and difficult, if not impossible to navigate. So this graphic actually represents job titles that our participants held currently or in the past. We found a lot of different job titles that reflected similar work, but then we also found job titles that reflected different types of jobs. So for example, this could be someone who works as a CNA. Oftentimes this was also called a patient care technician. So there's just a variety of terms for all of these job titles with similar and or different work. This makes it really difficult to actually compare wages across employers and distinguishing between roles with equivalent responsibilities. Additionally, we did hear from union representatives that sometimes employers created different job titles for similar work as a strategy to skirt around the union rules. We also created a series of graphics to illustrate the different education and career paths that our participants actually took. So in this example, participants who started out as medical assistants had a wide variety of pathways, and it often followed clinical and administrative routes. We did hear from a lot of participants who started off as medical assistants that their end goal was to become a registered nurse. Similarly, participants who started as a certified nursing assistant, they took various pathways, some of which ended up being non-nursing pathways, such as going into public health or working in health IT.
Okay. Hiring and promotion largely depended on who you know and the connections you have, regardless of credentials and years of experience. Workers were often hired initially because they knew someone or were related to someone to get their foot in the door, even at entry level. Particularly at hospitals, workers said that application systems screened them out unless they knew someone to intervene on their behalf. There was also differences in environment between hospitals and clinics. There was a clear difference in opportunities for and ease of advancement between hospitals, which tend to be more difficult, and federally qualified health center clinics, which were a bit easier to navigate. Hospitals were seen as the best place to get exposure to a wide range of careers and medical specialties, which made them especially appealing for individuals earlier in their career. However, largely due to the siloed nature of hospitals and bureaucratic application processes, some participants shared experiencing challenges with securing positions across departments. Individuals who worked in clinics or smaller hospitals, on the other hand, expressed feeling supported by their managers and developing closer relationships with colleagues who mentored them. When it came to the education and training landscape, participants were often confused or lacked up-to-date information they needed to make educational decisions. Many participants were unclear about accreditation, licensure, etc. When choosing schools. They often chose what was convenient based on geographic location or referrals from friends and family. Sometimes they received inaccurate information about which program or credential would be the best fit or the right next step. And prerequisites like the CNA certificate that is required for many associate's degree nursing programs were cumbersome and often meant additional application processes, more time, and tuition spent. For example, the medical assistant to nursing pathway was a desired path in the folks we spoke to, but it was particularly problematic to achieve in terms of the time and prerequisites needed to go from medical assisting into nursing. Many of the workers we spoke to also attended multiple institutions on their education journey and changed schools along their path to getting a credential due to various challenges, whether financial, academic struggles, various life circumstances that required them to pivot. Inconsistent transfer policies resulted in lost credits and extra time and money to retake those courses. Conditional hiring practices, which were enacted during the COVID-19 pandemic, exacerbated problems with inconsistencies in accepted credentials. And as a result, participants took many different educational paths, sometimes not always intentionally, and accumulated multiple credentials. So there were various supports and barriers that participants shared that they experienced on their career advancement journeys. Workplaces that supported employees in their professional development were particularly important in helping workers persevere through schooling, but also personal life challenges, including flexible work schedules and tuition support. School wraparound services and supportive staff were key to retention and persistence, particularly test preparation, study groups, career guidance and placement, and on-site childcare. Family and friends provided emotional and financial support and helped balance caregiving and household responsibilities. When it came to barriers, geographic location was a theme that came up repeatedly in our study in terms of commuting distance for school, clinicals, and/or work, and often limited healthcare workers' choices. Childcare was a particular challenge for women, both when attending school and working. Many women also did not know about or were unsure who to ask about available resources to support their career advancement, whether related to school, professional development, or workplace rights. Almost all of the women we spoke to worked while going to school as they could not afford to leave their jobs. And like we shared earlier, over half of our participants shared they were parents or had other caregiving responsibilities. This meant that restrictive tuition reimbursement policies and a lack of flexible schedules like part-time or evening classes were a barrier to upskilling. The role of supportive managers in encouraging, supporting, and advocating for healthcare workers for their professional development and promotional opportunities cannot be understated. Almost everyone who had been successful in an upward trajectory credited a supportive manager and/or mentor for their success. However, participants also recognized when they did not have meaningful connections, were not valued, or did not have mentors to guide them. And more specifically, participants mentioned the lack of women in leadership roles to serve as their mentors. Racial discrimination was a significant barrier for Black women across multiple positions and employers. Black women had a harder time finding jobs and opportunities for advancement, and it took them longer to get promoted, if at all, than white women. Women of color seem to have much less linear paths to a bachelor's degree in nursing, in particular, including more credentials earned and longer time to completion. Healthcare work environments, especially at hospitals, operated with insider information, which hiring largely dependent on who you know. Black and Latina women were often outside of these informal networks, compounding the discrimination they faced in their career journeys. Many Black and Latina women specifically mention wanting to serve communities of color and address racial disparities in their work, including wanting to go into public or community health in the future. We wanted to share with you one quote that stood out to us from a Black woman who was a manager at a health system. She shared, "You would not imagine all of the positions that I have applied for, and I know at least 3 to 4 people that personally that cannot advance. Well, I don't want to say that it's race related because they're all Black. I don't want to say it's because of their race because it shouldn't be. It should be based on their experience, but a lot of them feel that's the reason why they are not chosen when they have the experience to move forward."
So
I'll pass it back to Corey.
we actually have a lot more quotes in the report. I just want to let you know that we didn't share them all today because of time, but they really, I think, reveal, really put a face and a specific example to the findings that we are sharing today. So throughout the report and throughout the study, we found ways in which workers, employers, and training providers don't seem to be on the same page about what is most important for healthcare career success. So we, for example, might hear something from, a workforce development about a particular credential and what those people do and how that prepares somebody for that job. And then we would find someone with that credential who is hired either above or below their credential doing work that training providers and workforce development people don't think that someone with that credential can do. So there was really not a strong connection between credentials, hiring, and wages, which is interesting given the number of credentials and licensing and hiring, that is part of the healthcare workforce. The wages didn't seem to align with their credentials and years of experience always. What training providers said students want isn't actually what the workers wanted when we talked to them. So there's just this lack of alignment between the different parts of the healthcare workforce sector. I mean, this is hard because it's a big sector, right? And there's things are very decentralized. Their work is very different. And so they just aren't, really clear with each other enough. I will also say that, as Efrata mentioned, COVID did change the workforce in healthcare significantly in terms of what credentials are desired, what positions are more in demand, how strict employers are about who they hire, because we found a lot of conditional hiring policies. And sometimes I think those were not communicated, to workers or training providers. And I think what a lot of this comes down to in terms of some of this disconnect is the difference between this perception of an ideal career pathway, which is very linear. You're able to go to school full time. You're able to attain this degree, go back to work, get your work to pay for your next degree, and get promoted, this very kind of linear path that is ideal and that I think, in theory makes sense. But that was not the reality of the women we talked to in terms of navigating the maze because they didn't have the right information. They had challenges with finances or caregiving. There was life that happened. They had time in between. So going in a linear way just wasn't really an option for them. So I think that is something we really want to emphasize is this report is very much from the worker perspective in terms of what they are trying to do. Which didn't always match with what we were hearing from training providers about what they think that they need. In preparing for this study, as I mentioned, we were looking up information about different healthcare jobs and positions and wages. And what we found was most, at the time, this was not this year, this was last year, most postings, particularly from hospitals, did not list wages, which that makes it pretty difficult to compare, what is fair pay for any given job. And it's also compounded by the confusion over the job titles that Morgan mentioned earlier. So if you don't know what the pay is and the equivalent responsibilities, it's very difficult to figure that out. We uncovered disparities in pay for this same position in different hospitals, or even within different departments at the same hospitals. And workers told us that that was actually not uncommon, but it was very difficult to know how wages differed across the units and employers because they weren't posted. And we heard women that suspected that male colleagues were getting paid more or found out later that they were. We also talked to several women who told us that they wish they had known that to negotiate salary earlier in their career or upon initial hire, and that it never had crossed their mind to do that. And they wish they had done that because of their wages that they have that were so hard to get promoted or to get a raise once they started working. And as many of you know, a lack of salary transparency contributes to pay equity gaps, which is one of the core issues for women employed, independent of this particular research. So it was really interesting that that was one of the first things that we found here. Next. So hopefully many of you know this, but in January of this year, a new salary transparency law took effect in Illinois, where companies and organizations with at least 15 employees must include information about pay range, expected benefits, and other compensation that they'll offer in any job opportunity, and also promotional opportunities. So hopefully some of this lack of salary transparency that we found should not still be happening, because there is a new law in effect in Illinois. So there's a link in the chat. You can take a picture of this QR code to get more information about salary transparency. So we have a number of recommendations in this report, but I think one of the things that we really wanted to emphasize was the importance of systems change, because a lot of the things that we uncovered really overlap. They can't be solved by just a training provider changing, say, their curriculum, or by an employer just changing a hiring practice. They are all connected, and they need to happen together. So we really need collaboration between training providers, employers, workers, even licensing bodies and advocacy teams, because there's been a lot of work put into this, but it seems like sometimes the different groups aren't really talking to each other in a way that would be helpful. One of the key things they need to address is racial bias, underrepresentation, and equity gaps, which came up frequently and is also proven in the research literature. So it's not just something that we found. This is sort of widely been studied across the industry. So unfortunately, our study confirmed that. As I mentioned, there's been a lot of money put into healthcare workforce initiatives, but the challenge that we found is we would hear about these pilot programs or these initiatives and that they got started, but then we never heard what happened from them. So we were not able to learn from those programs, whether they succeeded or they failed or whatever challenges they had, which could have been really useful and should be useful across the healthcare workforce. I will say an exception is Westside United, who had a really great report that shared details about kind of what they did and the challenges and successes that they had. And we need more of that, because there's lots of these initiatives out there, but people need to know what happened so that we can learn from them instead of kind of reinventing the wheel every time that something happens. There also needs to be a willingness from our perspective to challenge the status quo. As we have shared this research over the last couple of months with different groups, we've often heard, oh yeah, that's a problem, or we know that's a problem, but I don't know how to fix it. And it sort of ends there. And we feel pretty strongly that yes, these are big challenges and big problems, but just because it's always been that way doesn't mean it needs to stay that way. And they're challenging and difficult to solve, but it's not impossible. And related to that, decision makers need to be at the table. We've also heard, we've been in some tables with workforce development people or employers, and they say, oh, yeah, we need to change this, but I don't know who makes that decision. So we really need kind of higher level decision makers to be at the table who are willing to really take a hard look at some of these issues that we found and work together to solve them. And then the other thing is that in Chicago, the healthcare workforce has pretty low unionization rates, particularly compared to other states. And based on the research on unionization, which we know helps to close equity gaps, generally helps to raise wages, we feel like an increased unionization might go a long way to solving some of the issues that we found, particularly when we've looked at other states who do things differently related to unionization, where unions are not just involved in hiring, but also in promotion and in professional development and even training programs. That is something that is not happening here in Illinois. We have in our report, our recommendations are sort of divided up by the different types of issues. So education and training, mentorship, hiring and promotion. So you can go back into the report to look at those, but these are some of the ones that we think are sort of the most important. So the first is addressing that the standardization of job titles across hospital systems. Every single person we've talked to has said, yes, that is a problem, but no one seems to either know who can fix this or how they would fix this, but it needs to be fixed. We counted up those titles that were in that graphic that Morgan showed, and we actually had more job titles than we did people, as I recall. So that is something that really needs to be addressed. Employers need to develop, clarify, and promote supports for workers to upskill. As we mentioned, everyone we talked to was working in healthcare and then returned to school at some point or another. And there were a lot of issues around that. So we believe that that needs to really be addressed so that workers can be successful in getting their next credential to get them to the next step. We also believe that schools need to create consistent and transparent transfer agreements. We had some students who spent a lot of time trying to find the perfect school for them so they could get their credits to count, and they explained how hard it was to figure that out. We also had students that didn't know they could do that and ended up at the school where they lost a lot of credits. So that really needs to be addressed given the many students that we saw that needed to move schools. Mentorship programs are crucial, as we said, for any kind of success, whether that's in education or in hiring. So that whether it's at an employer or at a school, and that's something that we really need to do, especially for women of color. We also believe that it's important to provide know your rights, salary negotiation, and understanding union contracts workshops, among other things, because many of the women we talked to did not know they could negotiate salary or how to do that. They didn't know what was in their union contracts. They didn't know what their rights were in the workplace. And they're like, that would be useful, but I don't know where to find that. So we can't, again, there are more recommendations in our report, and I encourage you to go there to look at that.
So at this point, we are going to open up for questions and welcome you to put any questions that you have into the chat. I see one that's posted there already from Olivia Greenfield. She's asking, could we consider a way to share the contact information of people on this call? I work for a nonprofit and think we might have some interesting opportunities for people invested in these issues. Olivia, we can certainly ask that when we send the follow-up email with the recording and the slides to everyone. Folks are also welcome to put their contact info in the chat if they would like to share it, if they feel comfortable sharing it. And Olivia, you as well can put your contact information in if you want folks to reach out to you. Oh, and I see you've posted your LinkedIn profile. Thank you. Are there other questions? I know that you're used to seeing a generic Q&A slide at this point in webinars. But since everyone's work life is extraordinarily busy and you rarely get an opportunity to reflect on things, well, you rarely get the time to really spend time reflecting on things. We decided to just put these reflection questions up on the screen while we were taking Q&A, but all of your questions are welcome. If you have thoughts about how what you've heard today resonate with you and your experience, how some of these issues show up for you at work, regardless of where related to the healthcare sector you're working, what recommendations would you suggest to address some of these challenges? And then what are the biggest barriers to systems change and how do we, as Corey said, together, because we need to work together on this, how do we together overcome them? So we have a question from Cameron. What are the plans to share this with workforce orgs, employers, and colleges to improve the key findings?
I can take that. So we have already presented the findings here at the Chicagoland Healthcare Workforce Collaborative. Sorry, April. At one of their meetings, we are actually going to Institute of College this week and talking with their nursing advisory board. We presented it at a statewide education conference as well as a nursing leaders conference. And we have a few more presentations coming up. And this is where we could use your help. If you have an organization that you believe, that you'd like us to come to, whether it's somewhere you work or somewhere you think we should reach out to, that would be really helpful for us because we want to make sure that this information gets widely shared and that something is done about it. So yeah, we have a lot of plans in place to meet with groups and we've done some already, but any suggestions you have would be welcome.
So another question that has come up as folks have shared the report, how the workforce sector should be thinking about expanding exposure and connections to roles outside of the ones people, particularly women, are typically connected or exposed to. Would anyone on our research team like to respond to that?
I guess I'm not, could you clarify that question? I'm not sure. Are you talking about within healthcare, outside of healthcare? I'm not clear. Sorry. How to answer that.
I think I might be understanding. Yeah, within healthcare, I will say, and Efrata, please correct me if I'm wrong, but aren't there some programs that, like at Rush, that has been really exposing high schoolers to different healthcare career pathways? Is that sort of what we're talking about of different introductions into healthcare careers?
I can add to that, and then Joanna, I don't know, maybe if you would like to come off mute and expand, but there are various upskilling programs that employers put on, right, to help their incumbent workers join different areas of healthcare that, that might lead to better wages or more opportunities. And those are great programs. It would be really great if we have data and information to know how they work or how they can work better. But I'm not exactly sure I would like to hear more from you what you think about or what you were imagining when you think of expanding exposure or connections to roles outside of the ones women are particularly exposed to. Are there any specific roles that you were thinking of?
Yeah, I'm happy to chime in just that. And my husband's in the healthcare sector. So when he read the report, he was like, well, what about this? And what about so IT, other kinds of roles where we just know, women typically they're exposed to these more entry level kind of nursing-like positions. And how do we expand the exposure? And if they're in those roles, how do we think about other career pathways for them within healthcare? So that might have clearer steps for advancement.
Yeah, one of the things in our report, we also highlight some best practices from different institutions, whether it's a education training provider or a workforce. And one of the things that Northwestern did, I'm not sure if Mandy, are you here? Is Mandy here? She can talk about the career day where people learn from different people at work. Can you unmute Mandy? Is she here? If not, I'll talk about it.
And Mandy, if you are here and you just raise
Your
your
hand.
hand, then we'll be able to unmute you. And I will say for others as well, if the chat is not working for you and you would like to voice your question, please feel free to raise your hand and we will unmute you. In the meantime, Corey, related to that, we have another question from Catherine that asked, did you find any promising practices from organizations and perhaps community colleges that have been in the business of bridge programs and career pathways for several or for many years?
Okay, so Mandy is not here, so let me share what we heard from Northwestern. They had a professional development series at Northwestern for their healthcare employees. So anyone from any department could come. And what they did was different people in different departments talked about what they did. So a nurse, an IT person, a radiology, someone that worked in, the business office, like all these different people within the healthcare system, because Northwestern Hospital is a pretty big system, right? There's lots of jobs. And they had people from different areas talk about what they did. And then different employees, no matter where they worked, could learn about these opportunities and figure out how would, if I wanted to do that, this is what this person does. What would I need to do to get there? And she said it was a very popular program and they recorded it so that employees can continue to go back to that. Because one of the things that we heard is that with hospitals, they're often very siloed, right? Because they're very big, all the departments are very different, and it's hard to learn about what happens outside your department. And so that was a way that they tried to do that. And she said it was very successful and people were really interested in learning about different opportunities in different departments, but they could still stay at Northwestern.
Corey, I was just going to chime in. This is April Harrington. I facilitate the Chicagoland Healthcare Workforce Collaborative and actually hosted a mini peer learning event for Mandy at Northwestern and her colleagues, as well as the team at Rush and the team at Loyola Trinity to talk about those employee advancement events. Rush just did a couple of their first events, big in-person sessions where incumbent employees seeking to understand their opportunities to advance could talk to different teams. They had career pathways, sort of maps that they gave to students and walked them through a new platform called Guild, which allows them to access free upskilling opportunities. So that's the kind of thing that we do within Chicagoland Healthcare Workforce Collaborative is allow these health systems to learn from each other on these strategies. I just wanted to uplift one big challenge is that I think the health systems are enormous, as you just mentioned, Corey, and those involved with each different occupation are many and varied. So one accrediting body is not going to look at things the same way another accrediting body has. Some accrediting bodies are very welcoming of apprenticeship models, for example, whereas others do not want students to be paid for their time in class or in clinicals at all, which is why at Chicagoland Healthcare Workforce Collaborative, we decided we need to get occupation specific and spend the time to get all the right people in the room. We're hosting a Chicagoland Respiratory Therapy Workforce Summit on November 4th to do just that with respiratory therapy, and I hope to do it with other positions in the future. But you know, when you're thinking about creating pathways, those who train and certify nursing assistants, or those who train and certify patient care techs, which is technically a different national certification, and I'm unclear as to whether people really value that certification. Um, are they talking to the nursing board and the people who uh, decide what an RN or accredit RN programs? These are huge issues that are not just statewide, but national, that require getting a lot of different bodies to the table to convene. And that's a big challenge. And I'll stop there. Anyone is welcome to reach out to me to collaborate on any and all of these issues. And we have some of our events on shyhealthworks.com. I'll put that in the chat.
Thank you, April. We have a quick question here from Kim. Did any of the participants work at a VA hospital?
I want to say we didn't have the opportunity to interview anyone currently working for the VA system. I believe maybe one or two participants had in the past, but we tried to get a really large sample, and so while we were able to get quite a variety, there are still some hospital systems that were left out of the study. So yeah.
I wanted to answer Matt's question that's in the chat about, did you find any recognition from healthcare leaders that the cost of the maze ends up hitting their own bottom lines, for example, through their paying the high costs of temporary nursing placements, turnover costs, etc.? I don't think we talked to any healthcare leaders that would have a thought about that, but that was our thought. And we heard that from some workforce development specialists that, our institution is paying millions of dollars to hire what they call agency nurses or travel nurses that are temporary. So bringing in people from other places who already have, say, their bachelor's degree in nursing to fill in temporarily. And they spend lots and lots of money to do that. And why instead don't we put some of that money towards upskilling the people that we already have who are working for us? And so we heard that not just from leaders, but some of the people that work in the hospitals, that they think that that balance needs to be shifted a little bit. In terms of the turnover costs, we actually heard frequently from workers, particularly nurses, that you can't get a raise unless you leave your institution and move to a different one. That's apparently standard knowledge, which again raises the cost of turnover. If that's the only way to get a decent raise is to leave, then you have a lot of people moving around. And we did have some people that talked about that, I moved here because it was better. I heard this other place is better, so I might try there next. So this moving thing, that there was a significant amount of workers that said that they don't believe that your employer is loyal to you. That was their exact words. And so why should you be loyal to them? So the turnover costs, we believe, are significant, though as a qualitative study, there was no way for us to get to that.
Thanks, Corey. We have one more question. This one comes from Claudia. Are nursing associations part of the research to support, such as AMA, National Association of Hispanic Nurses, ANA, National Association of Hispanic Nurses, Black Nurses Association of Chicago Chapter, etc.?
I can answer that. Yes, we did reach out to various contacts to conduct outreach and help share when we were recruiting for the study. And Claudia, if you are connected with any of those associations or chapters, and you think it would be good for us to present with you, please let us know. We are more than happy to continue to disseminate and continue these types of conversations with those groups.
Okay, and I see there's lots of back and forth in the chat, which we really appreciate. Folks sharing contact information, also sharing opportunities and background on some of the things that you're doing. If we have additional questions, I think we have time for one more question. If you posted a question and I somehow managed to miss it, please don't hesitate to post it again or to raise your hand and we will take you off mute and you can ask your question yourself. And you may see that Mary Kay has posted that we are capturing all of these notes in the chat. So those will be used going forward as well. So does anybody have one last burning question you're interested in posting before we let this go? Okay, well, I just want to say thank you, everyone, for joining us. We've had a large audience for this webinar, and we really appreciate you spending your time, taking your time to hear about the research that we've completed and sharing your own experiences in the healthcare and the healthcare workforce development space. I hope that you've learned something new from this research and that we've given you a moment to reflect. You have the links in the chat, again, both to the standard report and the in-depth report, which you'll find on the Women Employed website. You have contact information for Corey and myself, and we can connect you with Efrata and Morgan. We're happy to do presentations, and I see there are some requests for presentations already in the chat, or just to have discussions with you about our findings and recommendations and your experiences. And we look forward to talking with you going forward. Thank you very much and have a good afternoon.